Hey, everybody. Welcome to another episode of I
Wonder
Wednesday.
I'm Dr. Hausman.
I'm Dr. Gersberger. We're going to talk today about surgery. There's a lot of confusion. There's a lot of confusion about different types of surgery, why you should get it, when you should get it, those kinds of things. Yeah. So we're going to start with kind of the first one. LASIK is kind of the one that everybody thinks of when they think of a laser surgery.
What's the difference between LASIK and cataract surgery?
So LASIK actually affects it's just on the cornea. It's on the outer surface of the eye. And they take and cut a flap. When I say cut a flap, the surgeons that we send to actually use a femtosecond laser to cut that flap. It's more precise than using a blade, and it cuts the rate of complications down a lot. If you use a blade, you can wrinkle that tissue as you're coming across, you can perforate the eye, you can do other things. With the femtosecond laser, it actually has a very precise depth of cut, and then the flap is very, very, just almost perfect. So when you lay it over and do the treatment on the very front surface of the eye, then you can lay that flap back over and the edges seal down and heal up really, really well. Those scars are almost impossible to see. Even under a microscope, if you're in a hurry, they're difficult to catch. But cataract surgery, what is that one?
Where's that? Now cataract surgery is going to happen a little later. Usually LASIK surgery can be done early. That's more of a refractive surgery to help you go without glasses or contact lenses. And when you're about 20 years old or so and your prescription has stabilized and you don't have a super huge prescription, then you would be a candidate for LASIK surgery. So I have a lot of patients who are in their 20s who have had LASIK surgery, and they're going to experience great vision without glasses or contact lenses for years and years. And so the LASIK surgery happens usually in younger patients. With the cataract surgery, what happens there, as Dr. Gersberger mentioned, the LASIK surgery happens on the clear cornea, the front part of the eye. The colored part of your eye is called the iris, and right in back of the iris is the lens inside your eye that does the focusing. For everybody on Earth, as time goes on, ultraviolet light from the sun and normal protein changes inside the lens make the lens get cloudy as time goes on. When the lens gets cloudy, it also changes shape, which changes your prescription. And so as time goes on, when that lens gets cloudy, eventually it gets so cloudy, it doesn't matter what we do with glasses or contact lenses, we can't make that image clear. It's like you're looking through a really blurry, fuzzy lens, and you can't see clearly. So in cataract surgery, the surgeon will go in and actually remove the natural lens of the eye and replace it with a brand new clear artificial lens. And usually they fine-tune that power to maximize your distance vision. So usually after cataract surgery, similar to LASIK surgery, you don't need much of a prescription with glasses or contact lenses to see far away. You just need glasses for up close. And they're coming out with a lot of new technology to where the lens inside that eye can flex a little bit or use different technology to also increase your near vision as well. So there's a lot of exciting things going on there. So yeah.
There's a new cataract lens that they can put in, and they can fine tune that lens after it's in. Right. So before, they would do all their calculations, put the lens in, and that's what you get. If you have a little bit of prescription, that's our job to take care of it. With the new lens that goes in, it's called the light adjustable lens. We can actually use UV light to change the prescription on that lens and then lock it in place. Other types of laser surgery, SLT and ALT are laser surgeries on the trabecular meshwork that will lower the pressure for glaucoma. We also have corneal cross-linking, which is a surgical procedure that uses light to stop changes for people that have keratoconus, which is a progressive disease.
PRK, I was going to say, is another type of refractive surgery similar to LASIK. For certain patients with different conditions, PRK is going to be better for them. And so,
if it's a higher prescription, PRK can actually go a little bit higher because there's more corneal tissue to work with. They take only the epithelium off and don't cut that flap that we talked about earlier.
Yeah.
So for LASIK, I usually recommend 20, in their 20s is the prime time to get that. It will end somewhere around 40 because that vision will start changing and you'll need lenses for up close. So if you wait till you're 38 and get LASIK, you're going to be back in glasses within a couple of years, at least for the reading part.
But I would say after 40, it doesn't mean you're not a candidate. I've definitely had LASIK patients after cataracts after 40 that have had LASIK surgery because they were in what we call monovision. It's not as common, but for some people, it's perfect. Monovision is where you have one eye that's fine-tuned for distance, the other eye fine-tuned for near, and that's perfect for them because then they don't need to put on reading glasses and take them off or wear glasses because they have clear near vision and clear far away vision. And so I've had patients who have had LASIK surgery to surgically do that as opposed to using contact lenses to do that. So.
Yeah, so stop by. We can kind of talk about surgical options if that's what you're interested in. We work with great surgeons.
I was going to say, we also do the pre-op and the post-op for LASIK surgery there. So
and sometimes for cataract surgeries as well.
Absolutely, yeah. There's some. Yeah. If you wouldn't mind hitting the like button, that would be awesome.
Subscribe to us.
We are on Facebook and Instagram, and YouTube is another one there. So
yep.
Yeah.
YouTube is where we get to reach out to our younger audience, and we really want to do that. So
yeah.
stop by.
Yeah, thanks for watching. We'll see you next time.